I do have the pleasure of introducing and welcoming our afternoon plenary speaker, and I'll go ahead and introduce them. But before I introduce them, I would like to remind everyone that microphones again will be available for questions immediately following. So we're going to kind of split the room up, Amber and I, to kind of field any of those questions. And then immediately following this, there will be a break and there'll be beverage services, and refreshments available. And last call for pictures. And so if you've not had the opportunity to take that selfie, I know you're all just dying to get back there, all the way back in the Resnick room. Make sure you take a nice picture of you, your team, and snap yourself on social media. And please share what you're doing for National Mental Health Action Day. And then finally, if you need assistance with completing your evaluation, there will be laptops available at the registration table for your convenience. And so Kelly Davis is the Associate Vice President of Peer and Youth Advocacy at Mental Health America, where she works on the expansion of peer support and young adult leadership. She is passionate about lived experience-driven programs, policies, organizations, and research. Kelly has been awarded the Disruptive Innovative Award by the National Association of Peer Supporters and the National Peer Leader of the Year Award by Peer Apocalypse, if I'm saying that right. All right. And I know there was some talk about peers in the last presentation, so this is a great follow-up, I believe. Ms. Davis holds a certificate in applied positive psychology from the Flourishing Center, and her work has appeared in the New York Times, Teen Vogue, NBC Nightly News, NPR, and the White House. Ms. Davis holds a master's degree in nonprofit leadership from the University of Pennsylvania, where she served as research assistant in the Perelman School of Medicine, studying lived experience perspectives of inpatient psychiatric units. She is currently pursuing a certificate, specialization in mental health leadership from Harvard T.H. Chan School of Public Health. And Ray Scott is an executive board member of Students with Psychosis, a nonprofit that empowers students and advocates living with psychosis worldwide through community building and collaboration. He currently serves as VP of Programming and VP of Management for the organization. Ray is also a social work student at the Ohio University. I got that right. I think Cindy would have got me if I didn't. Right? With an associate's in social and human services, Mr. Davis is currently in the process of completing peer specialist training and has served on several other boards and councils, including Mental Health America's Young Mental Health Leaders Council. Mr. Davis is especially interested in peer support and art as vehicles of change. So without further ado, I welcome Kelly and Ray. Thank you.
Awesome. All right. Hi, everyone. I'm so excited to be here with you all today. It's been really amazing. Can y'all hear me? I feel like, okay, cool. It's been really awesome to hear everyone today. I've been so excited about conversations about peer support, harm reduction, psychosis, conversation about AI. It's been really, really awesome. So I am going to speak alongside Ray today. Our formatting got a little messed up, so about peer support and peer programs on college campuses and higher education. So the major things we're going to be covering: first, I'm going to talk about the results of a survey that we did of college students in or leading peer support programs, fill some of the gaps in campus peer support with what's available in the broader peer support literature and community. And then Ray's going to speak specifically about students with psychosis as an example of a peer-to-peer model for population of students that has historically been marginalized on college campuses. So, there we go. So as a starting point, I always like to start with my story. So I am a tail end of the millennial generation, which means that I grew up right when we see the spike in increased distress among young people start going up. And I'm also a child of the early intervention generation. So for me, before coming to college, I had my first suicide attempt when I was 10 years old. And I spent my middle school and adolescent years in all different sorts of treatment, all different sorts of medication. I showed up at college with like 10 different psychiatric diagnoses. And like many students, I was like, new place, new me. I'm going to stop taking my medicine and I'm going to be a different person now that I'm 300 miles away from my family. So that didn't go well. And by the time I got to my sophomore year, I could not function. And I was on the verge of dropping out of school. And I was diagnosed with bipolar disorder. And I was basically given the message that people like you do not do well in school. They don't do well in the world. Go home and don't stress yourself out too much. And I was like, wow, anytime I'm having trouble, people tell me to ask for help. And the people who know about people like me say I should give up. So I was like, all right, well, that's one option. Let me try literally anything else. And I got connected to the peer support movement of people with lived experience who created programs and research and organizations based on what it's like to be a person with these experiences. Getting connected to peer support for me as somebody, I often talk about growing up. It was like I had a secret part-time, sometimes full-time job out of school, being a sick person. And my whole life was built around a system that I could not seem to figure out. And through the peer support movement and seeing people who were also diagnosed with serious, chronic, persistent mental illness, like myself, doing well, being like some of the coolest people I've ever met, it changed my whole perspective. I had community. I finally had a place where I could share the things that I was going through and my experiences. And I also learned that mental health didn't have to be something that was done to me. But that there were things that I could do to support myself, tools that I could learn, that I could explore, that I could learn from other people, that I could navigate, right? Many students, I'm sure you all know, I shouldn't have been about to lose financial aid to find out that disability accommodations are a thing. And that, if you're lucky, at that point, that's what you get, right? If I had access to peer support, someone maybe would have told me that earlier. I had 10 years experience coming into school with mental health and had no idea. And on top of that, right, being able to advocate for yourself, telling someone that things that you know about yourself are valid, that you deserve to be able to make choices about your life and what happens to you. All of these things, creating a sense of belonging, this is the power of peer support and that peer support can have in higher education. And there's really, when I was in school, and I'll talk a little bit about the common pushback that students face, but in the past few years, we've seen so many more young people in serious distress reaching out for help. And we've come to terms with the fact that young people turn to each other first. And young people might notice that their friend is struggling. They're the first person who can see something. Maybe we should equip young people are having these conversations already, period. But maybe we can equip young people with tools to support one another. Similar to the presentation that just happened, a lot of times peer support is spoken about as like a workforce extender, right? So like we cannot expand if we believe that the traditional model that everybody should get access to outpatient therapy and a psychiatrist is the answer. We can't do, like, we cannot. We don't have capacity to do that. And we have a problem first where we over and under treat, right? So there are so many people who desperately need access to services who cannot have them. And there's so many other people who would benefit from support who do not need a psychiatrist and to go to therapy for a week for the rest of their life, right? So the ways that we tell people they should ask for help, I believe, are upside down. So for me, it's more than just a service extender. It's a reimagination of how people help one another and help themselves. We know that the mental health workforce, overwhelmingly, right, 86% of psychologists are white. We have serious problems with lack of diversity in the mental health profession that extends to college counseling centers, college students. Gen Z is the most diverse generation in our country. college students don't want to spend a bunch of their time explaining things that they shouldn't have to explain to a therapist instead of getting the help that they want to get, right? So there was a report that came out of the Born This Way Foundation that showed that particularly among BIPOC and LGBTQ youth, peer support was really, really important because they wanted to get support from other people who they identified with and who looked like them. We've heard a couple times about the power of belonging for adolescents in particular, right? Your peer group is so important. Trying to figure out who you are, where you fit in the world. And if you're given the messages like I and so many other young people are given, you might think there's no place in the world for you at all, right? And that's really, really devastating. And peer support, as I mentioned, can help students focus on the broader aspects of college. So one of the things that I think it like, it's not, I mean, for me, it makes me giggle a little bit, is like so much of campus mental health conversations don't talk about the education part, right? So like they don't mention what happens when you're in the classroom, and peers can help other students navigate what it's like to be a student going to school, because you're there for the education part. Like, what does that mean and how do you advocate for yourself? I will also say it was mentioned that there's a body of evidence that has existed that peer support is effective, but globally, what we found, and a lot of these programs are starting to come to the US. Sometimes they're called community-initiated care is one of the framings that people use to talk about it. But there is evidence that many mental health interventions can be performed just as effectively by non-clinicians. So training community members in basic CBT has, in many parts of the world and the US, been shown to be as effective as individual therapy. So what people with lived experience have been saying for a long time is really being borne out in the evidence. And I think demonstrates not just that this is a nice thing, because I think sometimes people think peer support is fluffy and it's a nice thing that we should do, but it's a real thing that is based in evidence. Going back, go back. It's not going back. Please help me. Okay. Okay. So the question is, what is peer support? So this is an interesting question. So I've done a lot of work in adult peer support specialist services, but also for youth and young adults. In higher education, people sometimes mean different things when they say peer-to-peer. Like a lot of times when people say peer-to-peer in higher education, they're just talking about other students supporting other students. What I'm talking about specifically in this, in the survey that we did, but also in this presentation, is students with mental health conditions or diagnoses supporting one another. People with mental health conditions do not own peer support. Peer support is just people with a shared identity or experience engaging in mutual support with one another. But in this instance, and a lot of the research that we're pulling from is the mental health movement specifically. It is distinct from and not a replacement for traditional mental health services. They do different things. Peer support is not clinical. And I think maybe this is changing, but I think it makes people a little bit nervous because we exist in systems that function on like short-term financial gain. So oftentimes investing in peer support for services is presented as a cost-effective way to fill gaps and things that we don't want to pay for. And that is not, it is. So what I am saying, it's not that we do support and get rid of everything else. It's that we consider peer support as part of everything that we do. So it's not this like false dichotomy or antagonist relationship that I think has caused a lot of problems historically in peer support. And there's many different models. So I have two models included here. The first is Lean On Me. It was started at MIT by a student. They're an anonymous text-based support line. They train other students to provide emotional support to one another. The second program that I have up here is a program called Project Let's. It was started at Brown University. They're on a number of campuses. They're a disability justice organization, so they specifically focus on students' rights neurodivergence, students who identify as survivors of mental health services, of having a mental illness. But there's plenty of other models, like I think there's folks from University of Michigan, Wolverine Support Network is really well known. They're very wellness based. So there's a lot of different ways that you can do it that builds on, I think that was spoken about earlier, the intersections of identity, where like your mental health experience might not be the primary thing that you navigate the world from. So there's a lot of different ways to build the same thing at the intersection of people's other experiences. So as someone who has been, I talked a little bit about my story, and then when I got like evangelized into peer support is this amazing, wonderful thing and the answer to all of our problems, I tried to start a peer support program on my campus, like a lot of students do, and was met with like, absolutely not. What if someone kills themselves? Is this a risk? Will the university be held liable? Who's going to train people? Is there any evidence for this? What if students do act like clinicians? Like, what does that mean for us if we're endorsing it? If this is a student club, like we can't have control over this. And is this just a way to avoid investing in the services that people want? And at the time, I was like, again, it's kind of this like disempowering nature. I say this in an academic space, but kind of being taught that, especially as a young person, a person with a mental health condition, everyone else knows better than you, right? So I was like, well, I guess like that doesn't align with my experience. So like we did peer support on like in people's apartments and all, because the school wouldn't let us do it. But imagine my surprise that like there were all of these questions that were proposed to me as major barriers, as the reasons why, sorry, this just doesn't fit in higher education. You might do it yourselves, but we're not going to endorse it. Is I found out when I got into broader mental health activism is that this stuff has existed, I mean, forever, but in mental health specifically for a long time. So the mental health peer support movement in the US, it's sometimes called the consumer survivor ex-patient movement. It goes back to the 1960s and 70s. They closed the large state psychiatric hospitals and dumped people on the streets. And they did not have places to go. They did not have resources. So they supported one another, similar to what we're seeing now, right? When there is a resource that is lacking, people are really creative in coming up with an answer. And just like we're seeing on college, it's just interesting to me that that is similar to what's happening in higher education, where it's like, all right, we don't have something that's working. Like, how do we create something else? And it's similar to the history of the peer support movement when there was so much need and so few resources that people did and built what they had to do. But what this means is that we literally have decades of research, of training, of programs that obviously had to have answered all of these questions that I was being asked as a student who wanted to have a peer support program on my campus. And just a little bit of background, because I was in a conversation recently with people who are leaders in campus peer support who told me that peer supporters have no code of ethics, which is fascinating because 49 states have a formal peer specialist certification. So it started back in the 1970s. In the 80s, peer supporters and people with lived experience started working as paid-in volunteers in the public mental health system. In 1999, Medicaid in Georgia started paying for peer services. 2001, they have the first certification. It's a CMS evidence-based practice declared in 2007. And as of today, 49 states in the District of Columbia have peer support certification. So this is not like a new or like secret thing, right? It's the insurance payers pay for this. There's all of these certifications and there's a big body of evidence. It's not something that students are making up. So we do have answers for a lot of the common questions. We also know from some of the articles that I posted, and there's been surveys, administrators are nervous about peer support programs, right? And not for no reason, right? We want to make sure that people know how to support one another. Students want peer support programs, which is great, but we don't actually know like what's happening across all of these different campus peer support programs. Or how those answers fit together with the body of evidence and resources that we already have. So I worked with, through Mental Health America, the Temple University Collaborative for Community Inclusion and Doors to Wellbeing, which is one of the Substance Abuse and Mental Health Services Administration, SAMHSA's Technical Assistance Centers, on a survey to get a little more information about what is actually happening for students leading or participating in peer support programs. Are the gaps that we hear about the gaps that they're seeing, and what can we do about it? So the 4 recommendations, and I'll go trying to get, I got to go fast. Sorry. I can go a little bit over, right? Because we started. Okay. So first, elevate student and lived experience leadership, ensure adequate and comprehensive peer support training, prioritize trauma-informed and human rights-focused approaches to mental health crises, and invest in the future of peer support and the broader mental health ecosystem. So elevating student and lived experience leadership. This has come up throughout the day, regardless of who is in, if it's student-led, if it's collaborative, if it's led by staff. Listening to students is always important, right? But what we found is that students who reported that they were in student-led programs engaged in and offered a wider range of activities that are like beyond just you're doing mental health, but are like helping students navigate resources and build community. And it's not that this made the other resources not useful, but I think some of the pushback, and it's the pushback that I got when I was a student, is, well, the counseling center has peer support groups that are run by clinicians, so you don't need that. And it's like, well, these different groups and communities do things slightly differently, and you might attract a different type of student in a different type of program. So it's important to think more broadly than just, well, we do this in one space, so there you go. Second is ensuring adequate and comprehensive peer support training. Training is this thing that, well, it's one of 2 things that really freaks campus leaders out, right? Is how do we make sure that students know how to support one another? They have the skills. Students also want training to learn how to support one another. They want to maintain boundaries. They don't want to burn out. They want to know, okay, what do I do if someone shares this with me? And we have standards. So the National Association of Peer Supporters, you can see this table, has practice guidelines, and SAMHSA also has guidelines for peer support that campuses can either use. From what I've seen, a lot of campuses like to build their own programs, or in the spirit of partnering, there are so many peer-run organizations, peer training organizations that a campus could easily partner with to create or collaborate for their own type of training. Most of the students believed that they had adequate training in peer support, but the thing that has come up a lot in even talking with other student organizations like Active Minds, there's a lot of upward pressure from students as being like, well, now that we're talking about more stigmatized experiences like psychosis or eating disorders, like I want to if that's not my lived experience, I want to be able to understand that, right? So they want more training and information on how to respond to their peers in different types of distress. They want more resources on how to support people in navigating community resources, and on practicing cultural humility and responsiveness. If we think about, again, holding next to one another, your typical peer support is teaching students how to support one another, and peer support from the perspective of how it's been used in the mental health system that has this broader navigation role. You come up with a really different program and you offer really different training. This is the most controversial one. Prioritizing trauma-informed and human rights-focused approaches to mental health crises. Anything with legal risk makes schools very scared. And they're not wrong, right? I have not heard of an instance. A lot of students are immediately shut down. Sometimes they're treated like they're trying to do something bad or illegal when they're trying to create peer support programs. I've yet to hear a university facing legal action for a peer support program, but if you have, I would be really curious to hear about it. To that note, though, we interviewed 5 different campuses. There's campuses who do it, and they have processes, they have formal procedures. If someone says that they're thinking about hurting themselves or someone else, they work with the counseling center, they work with the staff, they say, this is what we're looking for, this is what we do. One of the examples, their policy, they worked with the counseling center. Not only do they have a formal written procedure, they require all of their facilitators to do QPR training every semester. So there's ways that people have figured out to address some of these problems that shouldn't be a barrier for schools expanding access to peer programs. Bringing in the whole history of peer support and really common practices in peer support, as students can actually help prevent crises, right? So we know community and belonging, they're protective factors against suicide, but also one of the most common trainings in peer support and is often when peer support programs don't exist, one of the first things that are brought in is called WRAP, it's Wellness Recovery Action Plan. And it helps people create plans for managing their wellness. What do you do when you're well? What keeps you well? How do you know things are breaking down? What do you do when you're in a crisis? What do you do after a crisis? So you're empowering people to be thinking about that and planning for that instead of just leaving them kind of to fend for themselves or figure it out by themselves. And then finally, students are really interested in focusing on maintaining students' rights. So whether that is supporting students in navigating disability accommodations, I also work a lot on disability accommodations, and I keep referencing, I feel like I've heard different pieces of this throughout the day, but I think it's fascinating that if I have severe depression and I can't get off the floor, I have to set up 3 appointments so that I can request and get approved accommodations that I can share to my professor that he might approve to help me with my depression, which is like all of the things that I'm trying to get help with is the exact process that we are forcing students to go through by themselves, right? So having a peer navigator or someone to actually help you go through that who understands the system, I think is critical, and students really want to do that for one another. Psychiatric advance directives. So again, when it comes to crisis response, psychiatric advance directives are legal documents that people can use to indicate their treatment preferences if they are to experience a mental health crisis, right? So again, crisis prevention and empowering people and helping them to practice self-efficacy and feel a sense of autonomy in and being able to direct their own lives. And then leaves of absence, we know a lot of bad stuff happens on college campuses. Colleges unfairly kick students out of school. They have discriminatory processes for letting students back in school after a leave of absence. If you are a student dealing with this by yourself, you had a mental health crisis, when someone pressures you to do something, you think that that's what you're supposed to do. Again, right, it's the power dynamics. When my school told me you should leave school, I thought that they were telling me I had to leave school, right? And you don't know that when you're on your own and you have no experience with the mental health system or services. So having students be able to say, okay, these are your rights. This is what we can do about it. This is what might happen. Like, take a break if you need. This is not discouraging people to do the things that are right for them, but making sure that people have a real understanding of, hey, actually, you have a disability. Instead of dropping out of school, you could reduce your course load, and I can help you get documentation and go to the disability accommodations office instead of having you kind of get stuck and maybe not come back to school because you weren't supported and you didn't exactly know how to navigate the system. Okay, cool. And then finally, before I turn it over to Ray, invest in peer support as the future of mental health and the broader mental health ecosystem. So one, like, peer support programs aren't free, especially if you need dedicated staff time. So it's important to consider. I think people are like, oh, give them peer support, like that's cheap and people can do it. But you would need to pay for training, right? You need it if it's a student club, right? There's fees associated with it. So it's important to consider in planning and the amount of resources that you ask for, that it's not, you could do it all volunteer with no resources, but it's better to have actual resources and investment. Connecting with the broader movement. So again, talking about community collaborations. I think someone mentioned like a really, and I'm connected through MHA. Ohio is doing a lot on advancing the peer support workforce. So are they working with colleges? Could your college or university do some sort of partnership? In West Virginia, for example, the state funds, they have a statewide network for collegiate recovery programs that have a really big peer component. So how can you tap students into networks and peer support that go beyond just college specific focus, and can plug them into a bigger movement. One of the biggest things that people asked for when they completed the survey was they wanted to be able to talk to and learn from other students who are doing similar things on other campuses. So there's a real desire and need, but it doesn't exactly exist. And then collaborate with workforce initiatives to drive more students into mental health careers. Obviously, giving people exposure to this kind of work earlier can help them learn too that there's different ways you're getting good leadership experience, but that there's different ways that you can engage in mental health, right? You might learn, I actually really like the legal component of this. I like the advocacy component. I like program evaluation. I like design. There's so many different types of opportunities that a student can get when these programs are available. And the last thing that I will say is the growing conversations of peer support are being met with like real, legitimate, serious investment. And there's never enough, right? But investment and support. So advancing peer support on the national level was part of President Biden's unity agenda. And the White House released an announcement today for Mental Health Action Day. And peer support, again, was a really large part of that. So as we rethink what the future of mental health looks like, as we try to fill gaps to meet people where they are in the ways that matter to them, peer-to-peer models around mental health are really critical. So that is just an overview of what we found, blending kind of the history and learnings of the peer support movement with this survey, talking to college students. And then I'm going to pass it over to Ray to share about a specific peer-to-peer model called Students with Psychosis.
Hi, everyone. It's nice to be here. First, I wanted to give some background with my own lived experience because I find that important to my journey with students with psychosis. So I have schizoaffective disorder and among other diagnoses, but I have had about a dozen suicide attempts since age 8. And I remember when I was undergoing a treatment at OSU Harding, one of the providers there had told me and my parents at age 15 that basically because this treatment did not work for me, that there was no hope for me. So when I was going through my high school experience, almost dropping out and finally graduating, I began to think about that more deeply and think about basically the implication was that I should accept that I was going to die by suicide eventually. And I decided that that was not acceptable to me. So with my experiences in mind, I decided to enroll at Columbus State Community College. And since then, and since getting connected with students with psychosis at the beginning of my college journey, I have gotten my associate's degree and I'm continuing my education at OSU, gotten my driver's license. I've lived alone for the past 2 years, and I've been connected as I've been an executive board member at Students with Psychosis, and I just spoke at Harvard earlier this year to some medical students. So I have accomplished a lot. And I cannot understate how important students with psychosis was to that journey and the peer support that they provided. So I have some statistics here I found from a report on a college mental health that NAMI did in 2012. And the reason that I decided to highlight this report is that even though it's 11 years old, we are still seeing a lot of these same concerns and barriers being reported by college students, even though more are accessing services. So I wanted to highlight that psychosis often starts around the college age. So it's really important that we have services that focus specifically on psychosis. And one of those options is peer programs like Students with Psychosis. In this report, 64% of students had dropped out of college due to mental health reasons. and 47% of those with schizophrenia reported dropping out of college for mental health reasons. While 73% of students in a mental health crisis reported a mental health crisis, 35% of those reported that their colleges were unaware of their mental health crisis. And on this slide, the really important statistic I have here is that 42% of these respondents listed that peer support was critical to their success. So that's something I want to really highlight when I talk about students with psychosis and how we function, and the change that we're trying to bring about within the psychosis community. So I have a link to our website. It's sws.ngo. And our statement here is Students with Psychosis is a 501c3 nonprofit that empowers student leaders and advocates worldwide through community building and collaboration. So we do 160 plus hours of monthly virtual programming, and that can be through peer support video meetings as well as live chats on Discord. We have a creative meeting every week, and we have audio hangouts every morning as well. We're working on expanding our in-person hubs, and this is a global effort. So while we have started in New York City and built up through Boston and DC, we're also working on in-person meetings and hubs in South Korea, New Zealand, and et cetera. So our student advocate and faculty memberships are free because we believe that accessibility to these programs is really important. But we also have been working really hard in these past 2 years to get some other memberships established. And so we'll have some paid options that are getting started in this coming fall 2023. Other than our memberships, there are other ways to get involved, such as internship program, advocacy network, our community groups that we'll be starting, the brand ambassador option, and our event curator option. And these are open while we highlight those who have lived experience. These are open to advocates and allies as well. We also, you can see over here, we have a conference that we are planning, our own conference for August 26th of this year in New York City. We're really excited about this because this is our first conference, and we've been working really, really hard to make this happen. This is a picture of me and Cecilia McGow, our executive director, after our talk at Harvard University earlier this year. So our executive board comes 100% from the lived experience perspective. We find that it's really important that leadership positions are filled by those who have that lived experience because when we are in the peer support setting, we do not want our students to feel like they are being observed or studied by people who are in positions of power above them. So that's something that we have really highlighted, that the lived experience perspective is important for our executive board. And also mental health comes first for everyone, including our executive board members. So while we have been putting a lot of work and effort into our initiatives, we always want to make sure that we're being accommodating and understanding of mental health crises and other needs that are related to mental health. Like I mentioned, we have some community groups that are getting started. So the three that we are starting with are our BIPOC community group, our LGBTQ community group, and our comorbidities group. This is something that we found really important is our DEI efforts. So that's something that we're really excited to focus on. And we are definitely open to expanding this to include other populations such as first-gen students, but we are still working on focusing our DEI efforts. Here's a picture I really love of some other executive board members from Students with Psychosis. I just want to read you this quote from our website. Students with Psychosis aims to expand mental health and brain health advocacy at the college level to ensure psychosis representation, including a global perspective. Too often is psychosis left out of the mental health slash brain health conversation on college campuses, and our narrative is also often limited, excluding intersectional community members. So, like I mentioned earlier, students with psychosis has been really important to my own journey. I honestly do not know if I would have been able to get through my associate's degree and decide to continue on with my education if not for the peer support through students with psychosis. And that's because I found on a personal level that connecting with someone who has similar experiences to you is just so valuable and something that I've heard a lot of concern about from professionals is the idea of peer support programs taking place of crisis response resources or other professional support. But I want to be clear that students with psychosis is not a crisis resource. And we are not here to take the place of professional help. We believe that peer support is just as important as professional help, though. It's really important to understand that the narrative of psychosis it's been often limited, especially in the media. But people experience psychosis and their intersectional identities with psychosis very differently. Like it looks very different from person to person. So I would encourage you to keep an open mind when you are interacting with people who may have especially stigmatized conditions such as psychosis, and realize that there are a lot of factors going into their identity, not just their psychosis. And psychosis does not make them violent, does not make them unworthy of care, unworthy of support. So that's just something I really wanted to emphasize. So my key takeaway basically is if you take anything from this talk, I just wanted to emphasize that peer support is like really crucial to changing lives. It provides something that professional support most of the time cannot. And so when we're thinking about peer support programs, I want it to be something that you think of as like a viable, important option, rather than just casting it aside because of those concerns, like the legal concerns that Kelly mentioned. I've heard those a lot too. And a lot of college campuses that some other students in the Mental Health Leaders Council this past year have reached out and like talked about how there's no peer support on their campus, but there's rising rates of suicide. So I just really wanted to put it out there that these programs are really important and they deserve your support. And that's basically it. Thank you so much for being here and for listening. Kelly, did you have anything else?
What's there stuff? I'm on time. We're on time. We have like 10 minutes. We have time for questions. Oh, yeah. Sorry. No, you're good.
Actually, before we do provide the activity code, we do want to open up the floor for any questions. And so if you have any questions for Kelly and or Ray, we want to provide and create a space for that. Oh, actually, I see one down here.
Thank you. That was a very nice, great presentation. But I had a question about when you said 160 hours of programming. If you could expand on that. I was trying to listen and I just didn't catch it all.
Oh, yeah, of course. So that's 160 hours every month through our virtual programming and our in-person programming. And that's, like I mentioned, we have a variety of options. So every day we have the audio hangouts at 9 a.m. and that's a Google Meets call. And then we have the live chat twice a day on Discord. And that's a text chat that's open for an hour each time, every day. And then we also have throughout the week, we have additional video meetings, such as our peer support meeting on Mondays, our creative meeting on Wednesdays. We have a Q&A discussion group on Tuesdays. So we are like very involved and make sure that we have options every single day for our students.
Sorry, I'm just blown away by this. So it sounds very similar to me, like an intensive outpatient program would look. from like the hospital side of things, but it's being done through peer support. Am I understanding that right?
Yes, you know what? I think that comparison is similar, but what's important is that we at Students with Psychosis do not advocate for any specific medication or any specific treatment option, because we want to emphasize that like psychosis looks very different for every person. So that's something that we do not talk about in our meetings. We make sure not to list medications by name. But the like amount of support, I would say you could say it's similar to that. And I think, it just really highlights how peer support can be as effective or sometimes even more effective than outpatient treatment options such as partial hospitalization.
Thank you.
I have a follow-up because I don't know if this is part of the question that you were asking, but I guess you have all of that programming that's available to everyone. How many hours would you say like the typical member of like, are people usually going for like doing like 4 hours of a week, or like how often?
Yeah, we see members very consistently usually. I would say members usually spend like 2 or 3 hours a week with us. And typically it tends to be pretty consistent with what meetings they like to go to, which I think is great that we have like a lot of different options, because some people may lean more towards wanting those creative meetings, while others will want to just do the text through the Discord live chats. So that's why we have those options there.
All right.
Sorry. Can you talk about the connection between the peer recovery stuff that you're talking about here, peer coaching, and like 12-step programs? Like, is there a connection or not?
Yeah, so that gets at, I mean, everything's influenced by money, right? So part of it is like there's separate histories and cultures. So I'm sober. I got sober in AA. And there's two distinct histories of like the 12-step tradition and then like the mental health peer support movement. The mental health peer support movement is largely tied to like institutions versus a lot of the peer recovery coaching, because 12-step has predominantly been the model that's offered to people. That's largely like there's a large influence of 12-step culture in peer recovery, but it depends on, from a like peer services perspective. Many states actually have a separate mental health peer support certification and a addiction substance use certification. So I think it's similar, but the distinctions, I guess, from like looking at a 12-step model versus a recovery coach model is 12-step is really, there's a bit of a hierarchical relationship, right? You have a sponsor and then someone who's in the program. The sponsor is guiding you through a specific step. They have like a very specific kind of like answer to the thing that you're struggling with, versus peer recovery coach is more like less like really like not hierarchical, and you're kind of helping someone explore their strengths and the things that they might want to do with their lives and what's important to them. So it's a bit different. You're like not working a program in like with like a peer recovery coach. Yeah. No.
I'm sorry.
Yeah, no.
I might be conflating what you're doing with the groups with students with psychosis and the peer stuff that you're talking about. Is it mostly one-on-one, this peer recovery stuff, or is it group based?
It depends. So like some of the programs, so like Project Let's, which is the one that I mentioned, they do like drop-in, they do groups, but then they also have a peer mental health advocate program where they train people to work one-on-one as peer supporters and as advocates. And their training was actually like retrofitted from the Rhode Island like state peer certification training. So they do that. The support network, which is based on the University of Michigan model, they're all group based. So they do weekly groups and biweekly social events. So they're just different. It depends on the group. Collegiate recovery programs also, like they're often support group based, but some of them do have like peer recovery coaches as well. So it's mixed up because there's a lot of different stuff. There's a lot of different stuff going on.
I just wanted to chime in and piggyback off of that question because I'm a peer recovery supporter here in the state of Ohio. And it is kind of both. There are times when we do one-on-ones. There are times when we lead groups as well. So I just wanted to add that in there.
All right, thank you, Brad. I actually have a question, Kelly. So you talked about your first experience in trying to get peer services, peer, support started at a university, and we're amongst faculty, staff, and some students here. What advice would you give, a student and or a staff member if they want to kind of work alongside a student getting a group started or getting peer services started if the university is giving them the no?
I'll give it. I can.
That's a loaded
This
one,
is
sorry.
not a legal answer. I'm not an attorney. What I did, I just did. You can't stop us from like meeting with each other and talking. So like we hung out on the art museum steps and we went in people's apartments and we did so. But I think too, like a lot of the mental health awareness education clubs, if you join one of those, the chances are that like you have some personal investment and some degree of peer-to-peer is involved. But I think that too can help help build momentum because the school sees that this is valuable and this is happening. And I also think that being able to replicate a specific model is always helpful. Like the Wolverine Support Network at University of Michigan has really studied like the impact of their program. But then there's an increasing number of like maybe for-profit entities getting involved. So like Together All is like a virtual peer-to-peer platform that's monitored, that has clinical oversight. So there's a lot of options for how you can get started. Yes. I'm not advising you to break the rules.
I kind of wanted to chime in there if I can. So while like a lot of the efforts to get peer support programs started have been by people who have the lived experience, I really want to encourage you, if you are a mental health professional or someone who like works with policy or like otherwise has some kind of voice in these matters, to really advocate for peer support programs the same you would for other treatment options.
You're one of the I don't know how familiar folks in here might be with this. One of the changes that we talk about a lot in Ray's part of the MHA Youth Leadership Program, and it's like mentorship to sponsorship. Like, how do you leverage your weight as someone with a position of influence to get people whose voices aren't at the table? So I think part of it is if you're a faculty member or you have power, you should use your power to the degree possible.